All right, Michelle, like I said before, thanks a lot for doing this. My first question to you is tell the audience, just a little bit about yourself and how you started in the mental health community.
Sure, sure. Thank you again for having me on here, Laszlo. This is a privilege, and I've actually been listening to some of your podcasts and really enjoy it. And thank you for doing this for the community. Um, so, to answer your question, I'm Michelle Nosrati, a licensed clinical social worker in California. You asked how did I start?
Mm-hmm.
So I've always wanted to be in the helping profession. I wasn't sure what it was when I was little. I wanted to be a nurse. And then as I got older, I kind of noticed I want to help people with their emotional pain. I started in sociology, and then decided I wanted to kind of work to study social work. After getting my degree, I decided that I wasn't sure exactly what capacity I wanted to help people, if it was in private practice or in nonprofits. So I started my MSW program. And there I learned I was always fascinated more so with trauma and the trauma work. I worked in the nonprofit world for several years with those with HIV and AIDS, and then transitioned. My second internship was with trauma survivors of intimate partner violence, working with children and with adults in outpatient setting and also in emergency shelters, transitional shelters, and just found my love for the survivors there.
Mm-hmm. So tell me a little bit about the work that you currently do in your current role.
Beautiful. So I started working. I'm an EMDR trauma therapist in Los Angeles, virtual for now. Um, and I focus with the trauma. I use the trauma lens to try to help people using the tool EMDR to try to alleviate um, wounds, that beliefs about themselves or certain memories. I work with clients with PTSD and a lot of complex trauma, actually, to try to start to plant the seeds of healthier self beliefs about themselves, so they can start to feel safer in their body and their skin and start to see themselves in a different light as well as the world.
Mm-hmm. Now, is EMDR your only method of therapy, or are there others as well that you use?
Yeah, so I it's a great question. I used a lot of like trauma focused, did a lot of trauma focused work, in my time in the nonprofit. I was certified in trauma focused CBT with kiddos that I worked with, and incorporated a lot of those skills. I ended up getting trained and certified in it, when working with a lot of kids at the practice, and also in my private practice, and also in the shelters. So I use that, and I did a lot of CBT, cognitive behavioral therapy. But what I noticed when I was doing a lot of these methods is I noticed that, especially people with a lot of trauma, is that they could understand the concept. They learned a lot about the education. They were able to reframe things, but they still felt it. And I noticed a lot of physical ailments, and they just felt like I just can't move past these certain patterns, but I understand why I did it. So when I started using MDR, it was such a beautiful tool because people started to feel like they felt free from the trauma. In fact, I started working with someone who's on the spectrum, and she just couldn't stop having panic attacks, and she didn't know why, and she'd been doing therapy for 15, 20 years. We went down from having like 2 to 3 panic attacks a week to maybe one a month. She started to understand why it was happening, and it just went deeper, that where talk therapy couldn't go for her.
Mm-hmm. My next question is like, so let's step into some of the sessions, if you will. Like when you're working with clients in session, what does that look like? How do you sort of help those people with, a aspects of trauma or whatever issues they're dealing with?
I love that question. So it totally depends based on everybody. We're all so different. So we first want to come in, when we first come in, I want to assess if I'm the right fit for somebody, right? EMDR is pretty difficult to just jump into. In fact, I don't recommend anyone jumping into EMDR when they first start therapy. So I've noticed that once they kind of come to me, they've been in talk therapy for a while. They've read a lot of books. They've started to understand. And if they're not ready for EMDR, we just start to understand a little bit more about them, their experience, some of that history taking. I want them to start to trust their own experiences, learn about their experiences, why they feel the way they feel. Once that we've got some of that education piece, we start to use somatic methods to help calm their body, some of the relaxed breathing, other things, other, self-care types of skills that they maybe used before. And then we start the MDR work and start to shift on what they really want to accomplish. And then from there, we start targeting memories or core beliefs by using eye movement desensitization processing, which is like the bilateral tapping or eye movements. And it starts to target their own brain's ability to heal themselves. It's pretty miraculous, actually. So does that help?
Yeah, it does answer my question. What I was gonna ask is, what are some of the common themes that you notice in those sessions? Like, what do you notice as a clinician that clients mostly bring up as like a theme?
Yeah. So I guess every therapist would have a different answer for this. I guess in my work with trauma is that when we usually they don't feel a sense of safety and security in the world, even within themselves. Like, not when we look at trauma, especially complex trauma, where there's been multiple incidents of trauma, they don't trust their own experience, right? They second guess themselves. They don't, maybe even don't like themselves. So the common theme that I see is just not really liking themselves. And so when we start to kind of work on that and having compassion for maybe things that have happened or compassion for the people that may have hurt them or let them down, we start to open up, healing in many different ways. But I feel like on the different day that you could ask me that, I might have a completely different answer. But some of the themes that I start to see, at least for today, would be some of that self-love.
hmm And to that end, how do you make sure that those people feel, like they're at ease or that they feel sort of seen and heard?
Oh, yeah. So it's so hard to answer. I think by trying to listen and trying to understand and have compassion from where they came from, really wanting to listen to their experiences, to validate, and then the education piece of maybe why some of the reasons that might have happened, and trying not to change them and really asking what they want to work on, right? Where do they want to start, so that we don't have our own agenda in the room and it's more centered about what they'd like to accomplish and work on.
hmm And I always ask a psychologist this, like, what have you learned in doing this type of work as a clinician? And also, like, what do you still hope to learn, like, in terms of something new? It's a two-parter.
Yeah, the first part, say that one again.
What did you learn what have you learned as a clinician, like, based on some of the things that you've done so far?
um I've learned so much. I think it's kind of deepened. I think on a personal level, it's like helped in my healing. Like in this journey as a therapist, we're doing this to help other people and to help ourselves. So definitely some more compassion for ourselves in our work. I've learned, I think, the resilience of people, and how beautiful and determined people are. Um, and then I think for myself, what I'd like to learn is, doing the trauma work, I started to bring some of the parts, the internal family systems into the work. And I've noticed how, and how just empowering and how clients just start to feel better faster and start to kind of find, some of the work in like healing their inner child. And it's been so important in my work. So the next step would probably be getting trained in IFS. I would love to do that. I'd love to learn everything, to be honest. I also love Terry Real work and Gottman, and maybe in the next couple of years, slowly start doing this trauma work with couples, because I've noticed I've noticed in doing the work with clients is that, when you have trauma, it affects how we relate to other people. It relates how we are in our relationships, how we are with ourselves is also a relationship. And so that impacts the relationships. And when we do a lot of this trauma work with individuals, I notice that their relationships start to improve as well. So the next venture would be maybe starting to work with couples and getting trained so that we can heal couples individually in treatment and also um, as a group.
Yeah, because oftentimes trauma doesn't appear with one specific group, but it's multifaceted, right?
Absolutely. It is multifaceted and it starts so early and people are now starting to use the word trauma and that how we get activated by certain things and how we live in the past and how that affects our relationships. And there's just so many different parts of it. Yes, absolutely.
And lastly, to kind of wrap this up, what advice, tips would you give to people, who are entering the mental health realm that want to learn more about trauma-based strategies to sort of help folks, going through those struggles?
Yeah. I guess, I mean, so many things. I mean, I'd love to just share if they want to start on the journey, right? Trying to start with resources that are evidence-based, right? Not just opinions. And wanting to do like anything from EMDRIA would be wonderful. Anything by anything by physicians that have studies, right, linked to them. And if they want to find a therapist to listen to their gut, right? To do, to work with a seasoned therapist, but also someone who's listening and asking the right questions, someone your body feels safe with, right? Checking in with ourselves, um, and really honoring your experience. Your gut will tell you when it's the right person or the right resources.
It's finding that it's about finding that right fit because oftentimes, you go through this therapy search and you're like, that doesn't quite fit with me or my thinking.
Absolutely. And absolutely. And asking all those questions in the beginning on the consult call in the first couple of sessions. I'm usually wary of when someone just says, let's just try it out. Like I'd rather it be, on our first couple sessions when I start meeting with someone, I'll say I actually try to forewarn that I'd like for us to kind of just try each other out, for the first 3 or 4 sessions for us to feel like if I feel like I'd be a good fit, maybe I wouldn't be a great fit for everybody. I can't be, right? So if I also feel like I don't ever want to waste anyone's time or resources, and so if it's not a great fit on my part, I want to be really honest and refer elsewhere so that they can actually get the help they need, and vice versa. I always want to check in with the client on those first couple sessions and after, like, what are we still working on? What's happening? What's working here? What's not working here? How can we make sure that we're still a good fit and this is working for you? So definitely always checking in and kind of that, even though sometimes the honesty can be a little bit uncomfortable, it's so important because therapy is the microcosm to our life, right? And we want to practice those uncomfortable conversations in therapy so that the other person kind of has practiced those uncomfortable conversations in their life.
Yeah, and it can be hard. It can be hard.
Yeah. Yeah. Has it been hard for you as well?
In my experience, yeah, I've had therapy before, I've had to really uh get out of my comfort zone, if you will. So yeah, it can be tough for some people, but once you find that right fit, it'll all fit into place.
I love that. And sometimes do you find that sometimes it can be the right fit for a little bit of time and then it's not the right fit
Yeah,
because
it's like those changes. It's like going through those changes. Like it might be a good fit in these first couple of weeks, but then something is not right here. But yeah, it's all about again evolution and how things goes.
yeah, I totally agree. And when it's time and then when each of you have kind of it's come to a place where you've learned everything you can from this therapist and it's the time for it to end and honoring that time and then going to the next phase. It's all beautiful.
Yep. All right.